Hi, welcome to My Favorite Mistake. I'm your host, Mark Graban. Our guest today is Dr. Tyler B. Evans. He is an infectious diseases and addiction medicine physician, a public health leader, and author whose career is focused on serving historically marginalized communities. Dr. Evans is the co founder and CEO of Wellness Equity Alliance, a national public health organization. He's held several leadership roles across government and nonprofit healthcare, including serving as chief medical officer for New York City during the first COVID surge and later leading large scale vaccination efforts across multiple states. He's also the author of the new book, Pandemics, Poverty, and Politics, which examines how inequality, misinformation, and politics shape public health outcomes and what we can learn from past and present crises. So, Dr. Evans, thanks for being here on the podcast. How are you?
I'm well. Great to be here. Thanks for having me.
Yeah, well, it's an honor to have you here, and there's a lot to talk about with your book and everything that has happened and is happening. But first things, really fascinated to hear what your answer is going to be from the things you've done. What is your favorite mistake?
I'd say my favorite mistake is was I was working when I finished my clinical training in infectious diseases. I went out to all I really wanted to do was work in Africa, mostly work in the global south to work with organizations like MSF, Medicine Sans Frontières, Doctors Without Borders, and organizations like that to just to be a sort of part of the mission to help some of the most historically marginalized communities across the world.
Mm.
I had sort of my light bulb moment to get into medicine was in the late '90s, early 2000s when I was a student working in places like South Africa and Uganda, which was a very sort of I guess a famous time because we had folks like Nelson Mandela and other folks who were really just thought leaders in terms of, and there were medications that had the antiretrovirals that were sort of changing. And so lots of attention were sort of put on, countries like South Africa and Uganda to really kind of focus on the HIV efforts. And so that was my light bulb moment. And so I sort of continued my training and, had the opportunity to work in that space. And I was
Mhm.
very, very excited to do that. And then I was in a relationship, at the time, and this happens in real life, right? Like, you have all these aspirations and then real life happens. And so
Yeah.
my partner at the time wanted me to come back to get a real job in the United States. And so I came back to get a real job with the most unprivileged place I could possibly be, which was the Indian Health Service on
Oh.
the River Reservation in Wyoming. And, that ultimately helped to sort of shape my career and actually, as of last week, we just entered an agreement with the Northern Arapaho, which is the tribe that I used to work for, to help sort of scale up tribal health programs in Colorado. So, I think it worked out in the end.
So, is it was it that job in Wyoming then that seemed like a mistake at the time, or tell us more about
No,
that?
the mistake was sort of giving up my dreams to be working in the global South so that I could
Oh.
start to go back to the United States to kind of
Mhm.
part of my sort of career goals. I really
Yeah.
want to be working outside of the United States. But the sort of unintended consequence of this relationship was I actually came back in, made a I tend to be very unconventional in my sort of thinking, made a conventional decision, which ultimately had conventional sort of outcomes.
Yeah. So how did that play out? Or I mean, you at the time you felt like it was a mistake, but you were trying to make the best of it.
Yeah, I always wanted something different. I've always been a big thinker. I've always Global South at the time and in the '90s wasn't really as sexy and as sort of experience as it currently is. I had certain mentors, people like Paul Farmer, who had helped to sort of like guide me through this adventure, and so that's what I wanted. I wanted this. I was this adventurer. I wanted to help against some of the poorest folks in the world. But I found that going back to Wyoming, going back to the US and then going to places like Wyoming, working with Native Americans. I mean, I was a community health director and I would run the epidemiological analysis on the tribe, and our mean survival was the age 54, which wasn't really that
Wow.
different from what I was experiencing in sub-Saharan Africa. So I think it was a compelling opportunity for me to really see all of the challenges that we have in the United States. And there's a, sort of well-known expression that, sometimes, local health could be global health. So that was a very concrete and real representation of that. And then I was there for a bit, and then I moved, also because of the relationship, moved back to New York, and
Mhm.
was the director of the infectious disease director and the director of gender affirming care, and that also was a, and I ended up building a refugee program, and so I started to sort of cultivate a career based upon these accidental sort of like, career steps, and it ended up working out. And during the COVID-19 pandemic, while a lot of my colleagues had been working in the global South, and that's like areas in which I often think about, and I often, I sort of, wanted to get out there at some point.
Yeah.
But, I told them, I said, "Listen, like, we got so many." I mean, when it came to the mortality in the United States, we had some of the worst outcomes into the other OECD countries, and even compared to other developed countries. So I'm like, "We've got a lot of work to do here." And so I'm very happy with continuing kind of my
Mhm.
my efforts and my sort of focus, here in the US. And then when we fix the public health problem sometime in the next 20 years, then I can go off and, export some of these models to other countries. Oh,
Okay, because I was gonna ask you, you're still relatively young, the opportunity to go and re-pursue challenges in Africa and other parts of the world that lies ahead, it seems.
yes, definitely.
So, boy, Wyoming to New York, that's quite a jump. So yeah, big changes, and it kind of points to, yeah, just, variation in health outcomes from state to state, county to county, wealthier parts of the country to poorer parts of the US.
But
That's
but not as much as you'd think, and that's
yeah.
really that was the thinking behind the book, was that I could be in South Sudan, or, Southern Wyoming, or South Bronx. I have a theory on the Souths. And yet the conditions, or the feeders, were very much the same. The scales of the magnitude of burden of disease were considerably different. You look at South Sudan versus the Bronx, but, what's influencing these outcomes, and sometimes actually the actual outcomes. I mean, in parts of the book, I give the reader a few different sort of scenarios, sort of try to be sort of visual scenarios on these different sort of environments, and I said, "Choose one. Which one is South Sudan, one is Wyoming. Can you choose one is which?" And I think if I were reading the book, I would have had a challenge sort of reading it. So, the reality is, even though we're in the US, if you're in these areas, sometimes it's really not that different.
Mhm. So in England, I think there's an expression, the postcode lottery of, where you're born has a lot to do with outcomes. And, here in the US, I saw a map recently about life expectancies, and it was maybe coincidentally, there were shades of red and blue. And it really almost looks like one of these political maps of county by county,
Mhm.
red versus blue.
Yeah.
Real tell I mean, you're nodding your head in recognition. Tell us
Absolutely. I
more
mean,
about that. Yeah.
geography is a social determinant of health. There's no doubt about that. I mean, when you look at sort of unpacking the different, I explain this in my book, when you look at sort of unpacking the different sort of the classical definitions of what the sort of the social determinants are, built neighborhood, built environment is one of them, right? And we know that there is a correlation with geography when we look at just the civil planning of the United States, right? When we look at urban environments, we know that there was historic redlining, that sort of led to sort of outcomes, um, certainly outcomes that led to sort of imbalance or polarization of wealth. But also there's clearly a healthcare correlate to that as well. I mean, when you look at the sort of the redlining, for example, New York City, and you look at like the Bronx, for example, the Bronx famously is consistently the bottom of the barrel when it comes to sort of healthcare indicators across all counties in New York State. And And the irony is there's actually considerable access in the Bronx.
Mhm. Sure.
There's at least 2 academic medical centers, as well as, a number of FQHCs, federally qualified health centers, and other access points in the Bronx. But it's not just the literal physical access, it's all of the other components that goes into it. It's the
Mhm.
transport, and it's the perception, it's the trust. And a lot of that could be sort of drawn back to the sort of the geography. So
Yeah.
it could be 100 miles away, and it could be 10 miles away, it could be 10 blocks away. And sometimes just that, and that's enough, that's sufficient to determine, access and healthcare outcomes.
Yeah. And I mean, there are so many variables that you mentioned, access. So it's one thing that's often pointed to, with rural communities, that there's poor access to care, rural hospitals, critical access hospitals losing funding and shutting down. And I know you talk about, this need or desire to depoliticize public health, but the reality now is that it's politicized. Tell us more about the variable, whether this is affecting health measures now, or if it's going to, of just the political polarization of, accepting vaccines or not, accepting public health nutrition recommendations. And it just seems like things that you wouldn't expect to have been polarized a decade ago are now polarized. It's, my team's views versus the other team's views.
Yeah.
Tell us more about that, how you see it.
Sure. I mean, so just to zoom out for a sec, public health and healthcare different, should be more integrated, but they're not.
Mhm.
Should not be politicized at all. I mean, public health, literally in its name, is a public good. It's a common good for all, and it's there to create this sort of the safeguards and the protections for our communities. And it's not just vaccinations. I mean, there is this hyper focus on vaccinations as being the sort of the only really sort of manifestation of public health, but it's way beyond, right? Like, and it's so vaccinate. What are vaccinations? Vaccinations are a safeguard or a protection against communicable diseases, which is a big part of public health. But we've got so many other domains: maternal child health, we've got environmental health, we've got occupational health, we've got other non-communicable diseases, mental health, substance use, et cetera. So many different sort of areas or domains of public health. Why it's being politicized today is curious. I'm not going to say I
Mhm.
don't understand it. I spent a lot of time thinking about it. I think I starting to understand it. I think in today's space right now, there's this sort of attack on expert opinion.
Mhm.
And, and so it's not just public health, because really the core driver of public health is science, right? We
Uh-huh.
need to act on the public's interest based upon, what the science, what the evidence is providing to us. So a great success story in public health is actually, and this is why I want to get away from the vaccines, is
Sure.
is smoking, right?
Mhm.
As a result, as a result of public health efforts, banning it from a lot of sort of public buildings, certainly starting with like the restaurants and bars,
Mhm.
back 15 years ago or so. We've had significant success rates. I mean, we're down to, it's been a few years since I checked, but I think our prevalence is less than 15%. I think we're closer to like 10% of a prevalence of tobacco smoking. That's really incredible. When you compare that to Europe and to Asia, which intends when it comes to a lot of other public health outcomes, they're far more sort of advanced than us. But this is a big one, given the fact that cardiovascular disease and cancer are number two killers in the United States and actually many parts of the world. And we
Right.
know smoking was the number one preventable cause of death. It still remains it. I mean, it's closely now being outcompeted by obesity. But anyways, these are success stories, and and we were doing this based upon evidence. We knew, right, back to that famous 1960 Surgeon General warning. We knew that smoking would lead to a number of adverse healthcare outcomes, and the
Right.
more evidence that we were able to collect, the more that we were able to actually create concrete sort of implementations that would actually stop people from doing something that they were literally addicted to do. I used to smoke my stopped 17 years ago, right? I went into my residency program. I'm like, it's probably a good idea that I'm not smoking in
Yeah.
my in the hospitals or whatnot. But I mean, we needed more people to basically to do the health education and then actually implement the measures. So I just wanted to flag before we zoom in further. I just want to flag that this is for all communities. It doesn't. It's red, blue doesn't matter, right? This is to protect all of us. Now,
Mhm.
I like to when it comes to zooming into to infectious diseases, right? Infectious diseases do not understand the difference between blue and red lines, whether it's county lines
Yeah.
or state lines. They do not understand the difference, right? So they will naturally have a predilection for people that don't have the safeguards. So the fact that somehow public health has become this like trigger word or words concept for a lot of folks, and there's this public health governor public alliance right now, where 15 governors have come together as the result of the CDC essentially being effectively dismantled and other expert agencies effectively being dismantled. A number of governors have come together. Why are they all in blue states? Again, public health is there for all. And, and so who knew we've had 3 to 4 very divisive elements in this country, certainly abortion, religion, guns, why face masks and vaccinations have now been sort of, added onto it. I
Mm.
That part is unclear. Other than getting back to that attack on expert opinion,
Sure.
people don't want to be told what to do, right? And they don't want to be they're a lot of people in today's world are living in our echo chambers,
Sure.
they are just listening to the buzz of other folks. They're not getting their input from actual experts. And this is not just about physicians. This is not about scientists. This is zooming out further. We're talking about other experts in their sort of respective fields. We should allow them to give us their input. This is part of the reason why the United States is such a successful country is because of our educational sort of, infrastructure. We've provided so much technical expertise that we've actually been able to build this incredible infrastructure for tech, for biomedicine, et cetera. And so it's curious that there has been this sort of this inverse and almost this push against things that we've actually built and we should be proud of.
Yeah.
Uh, so it's we have to move away from that. There has to be we have to keep reminding ourselves that actually like having all of this expertise is a good thing and it helps us and it keeps us safe.
Yeah. But I mean, unfortunately, some of these factors that lead to the echo chambers, the internet, social media, fractured news channels that people choose depending on what part of the political spectrum you're on or how extreme what extreme parts of the spectrum are not. I don't. Some of that doesn't seem to be coming to a close. Some of that seems to be getting worse. Is there anything that can interrupt and bring things back to more of a shared perspective? It seems like people really embrace the fact that they have a different view.
Yeah, I think that we need honestly, I think public health and medicine and healthcare need more of an emergence of a solidarity sort of movement so that healthcare professionals, not just docs, I'm a doc, so I'm sort of biased, but physicians, nurses, epidemiologists, other frontline workers, technicians, medical assistants, et cetera, the whole spectrum of healthcare and public health, we need to red and blue states, orange, et cetera. We need to all, sorry, orange, purple, et cetera. We all need to sort of start banding together and really start socializing the message and working along the lines with other communities that are within those sort of states or counties or municipalities to get the right message across, right? Because it's all fractured and it's
Mhm.
just noise, right? And it's being further sort of broken or fractured apart as the result of our talking heads on sort of media and the politicians as well that are giving expert air quotes on
Yeah.
things like Minafin and other things. Like we need to stop that. We need to get to there's a lot of healthcare professionals that have different sort of, cards, red, blue, et cetera. We all need to start banding together and get the right message, be uniform in our
Mhm.
messaging. And that's going to be that's a Herculean effort, but I'm an optimist and I do think that there are opportunities for us to come together. There are agencies or organizations out there like the National Association of City and Community Health Officials, the Association of State and Territorial Health Officials, the Big Cities Coalition. These are associations or National Association of Community Health Centers. There's organizations that are out there that bring communities, healthcare professionals, public health professionals together. American Public Health Association. We need to bring these groups together and really start bringing some of those leaders so that we're all singing to the same sheet of music and then talking to our constituents, talking to the local politicians, talking to the interfaith leaders in those groups so that we all can sort of, be bringing the right message because ultimately we all want the same thing,
Yeah.
right? Which is really protecting our populations and our public's best interest.
Yeah. Yeah. And there is, I mean, there's this long history of, back to your point, if people don't like to be told what to do, almost this knee-jerk reaction on an individual level, in workplaces. I mean, I've said that before, but yeah, people don't like to be told what to do. If you're a leader and you give a command or an order versus treating someone like an adult and helping them understand why they should be doing something. I think that applies, in a workplace. It probably applies more broadly, but you can find videos. I ran across some of these earlier. If you consider, let's see, seatbelts, a public health issue.
Early. That's
You know, the percentages of people wearing seatbelts is much higher than it used to be. But there are videos from the 80s of people complaining about seatbelt laws, and they would say, "Well, that seems kind of communist." Like that word gets thrown around, and then laws cracking down on drinking and driving and trying to convince people that's, just because you get away with it doesn't mean it's okay. And there's these clips and people being upset. And guess what? Well, these laws about having a beer on the way home, that's kind of communist. And, I mean,
Well, but first of all, we also need a better understanding of the political sort of words or references that we're using here, because
yeah,
I would actually argue that, that would be more fascist, which is quite different from one another. But
sure.
no, absolutely. Seatbelts are a perfect example, absolutely 100% a public health measure, right?
Yeah.
Yes, people grumbled about it. And yes, of course, with the sort of the drinking driving, we know now in 2026, these were great measures. So these are the same references that to the smoking. And we had to, and ultimately, how do we enforce the seatbelt? Yes, it's a combination. It's always for effective implementation of these public health measures. It's always a combination of, how you roll it out. I think with the vaccinations, what happened is we rolled it out. It happened so quickly,
Mhm.
right? Now, with childhood immunizations, those have been in place for a very long time. And yes, there's been some, some outcries here and there. The purported correlation with autism, which is not a real thing. But for the most part, I think most folks were on board with the concept because it was gradual, because there was education, and it was because it was protecting our kids and our teachers and everything that intersects with things that we, care so much about. With the pandemic, it was forced upon us, and I was one of the people forcing it, so quickly that people weren't ready, right? And
Mhm.
also, we were not working in lockstep with one another, right? We had different folks that were saying different things, and sometimes I make the analogy of like when if you're going to the hospital and you've got 2 doctors that are openly arguing about your diagnosis and your treatment, like
Mhm.
confidence in that institution's ability to handle your disease or your presentation or your symptoms is going to be pretty compromised, right? So
Yeah.
you want healthcare professionals to be on the same page. Why do doctors wear white coats? Right? It's a costume, right? We could argue that it's to reduce the risk of microbial transmission, but most
Yeah.
doctors
Well,
have their white
I
coat.
mean, if you never wash the coat,
Correct.
right? Yeah. It's
So, we wear our costumes, we put on our capes, to come in because it gives people this feeling that somehow we have this expert level of knowledge that makes them feel comfortable about being there. And so, as healthcare professionals, not just doctors, we need to continue to provide that, right? Like, we cannot be bickering back and forth about this or that. So, that's what I was saying. We need to really have this solidarity, sort of connection that healthcare professionals are really coming together and getting on the same page. And we need to let the politics out of that. It is
Mhm.
from either side of the sort of the spectrum, from the liberal or conservative sides, they need to get out of these conversations because it's just not their space. Should we invite other folks into these conversations? 100%, right? 100%. We need to have conversations with communities, like I was saying before, interfaith organizations, other folks that have the faith and trust of these communities, and they should be able to voice their concerns, and we should be able to respond to them and not gaslight people or provoke people that believe a different way. It is as somebody who is, trained in this, understands all of the principles of certain immunology, microbiology, it can be frustrating sometimes when I have to, like, spend a long time explaining why protecting your kid or protecting yourself against this is important. It's it will, I'm gonna be honest, it sometimes get frustrating, but it's worth it. If we're able to change a few people's opinions and then they can ultimately change other people's opinions, it's worthwhile, to but sometimes we have to just slow down and have those conversations.
Yeah. And one thing I try to be mindful and again, thinking in more micro workplace situations, the difference between an opinion and a fact.
Mhm.
They're back to the political realm. The late Senator Daniel Patrick Moynihan, the great quote of everyone is entitled to their own opinions, but not entitled to their own facts. And, people say like, well, I have a right to feel a certain way. I'm like, well, yeah, you have a right to feel however you want in a relationship or politically, but that doesn't mean that there's not some harm when that feeling or that opinion flies in the face of fact. But let me turn into a question. I'm wondering about your thoughts on the role of media, where I feel like sometimes the media goes out of their way to both sides an issue, and there's a different expression about like if it's raining, I want the meteorologist to tell me the fact of what's happening, not bringing in two experts to argue about whether it's raining or not, that there's not two equally correct sides to the question of, is it raining right now? How does that apply when it comes to these questions of medicine and public health?
I think that's right. I think that, yes, I mean, I agree that when you have talking heads on both sides that have radically different views, radically different opinions of a fact, I think sometimes it is disruptive because it provides these people with the sort of the platform to assume that somehow they are experts on something that they often are not. Now, if you have a panel, for example, on with often doesn't happen, not that more in like conferences, but if you had a
Mhm.
panel discussion on, Fox or CNN or whatever, and it was, some the physicians or epidemiology experts on one side, experts on the other side that could had different, slightly different the facts that the ultimately the core beliefs were the same, right? But different ways of how to slice it. That's fine. There's no issue with that, right? I mean, there's always different ways to approach that. Now, we have to think about, and sometimes, when it comes to journalistic integrity and sort of like open
Mhm.
transparency, like that becomes it's a slippery slope because it's like, how much do you actually share with like the community? Like, for example, I'm a physician leader, and so I run an organization called Wellness Equity Alliance. If I'm having respectful and thoughtful conversations and possibly disagreements with my executive team and my board members, et cetera, about something, I'm not going to let the whole team listen into that, right? Because that's going to somehow create this sense of it's going to impact their confidence in us as leadership and whatnot. We're always, I mean, disagreement is a healthy part of any sort of organization or political entity or country, but there has to be a healthy discourse to sort of converse on that. And then I think we need to, whether or not this is literally ready for prime time is up to the experts and the leaders in that sort of space. The problem is we're in this space right now of we're in a leaderless world in many ways, right? Like
Mhm.
we're not going to get into the politics here, but
Mhm.
seeing things that are happening every day in the last year.
Mhm.
What's happening is not, and it's not just the US, this is across the world. What we're seeing, and actually zooming out further, as much as last year, it's the last few decades. I mean, what we're seeing is increasingly, we just had Martin Luther King, Day yesterday.
Right.
I sent an email to our organization, just reflecting on the incredible words of this man, who existed. His words, his ideas, his vision existed in the 1960s, right? I mean, we're now out, 60 years beyond that.
Right.
And I feel like we have gone, thousands of steps backwards, right? Because we don't have the right sort of leaders in the right positions to say, okay, this is the right time for X, this is the right time for Y. So it's the same thing apply for public health. The same thing's going to apply for media, et cetera. We need more adults in the room to really just, when is this appropriate? When should these discussions actually take place? So they're not triggering people and people are misinterpreting what these people might be saying.
Yeah. And I'm thinking back to this question of, is it raining? I can tell you where I am right now, on the northern Kentucky side of the Ohio River. It is not raining outside. I feel confident reporting that fact. Now, I'm not a trained journalist, right? So, like, as an individual, there are things that are directly observable. You wouldn't disagree with me about whether it's right. You can't see, but if you were here, you would agree with me. I don't need to be a trained journalist to report that fact, and I certainly don't need to be the meteorologist. But what the meteorologist could do is tell us what's likely to happen tomorrow,
Sure. Yep.
and then there's a whole level of, let's say, the climate scientists who are going to tell us what's going to happen in future decades. And
Sure.
is it fair to say, like, the further out that we get from the reality, or the more we are in the forefront of science, the more likely there is to be disagreements of what's going to happen as opposed to what's happening now? That seems to be a challenge.
Yes and no. I think that's right. Yes, I think there is probably, sort of frame my words appropriately, right? I think
Well,
that there's a proportionality of expertise or training
or different expertises, right?
in it to help the longer something is sort of, potentially is going to be taking place, the more sort of expertise or training we may sort of need for that. Having said that, I think in healthcare though, there are certain phenomena that are taking place right now that 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 folks, that lay communities, non-expert opinion may not be able to see. And like when you're looking at like the current prevalence of something happening, or if you're looking particularly at sort of infectious diseases, sometimes which are microbial, that you literally, it's not like rain where you cannot see, there's no manifest sort of concrete sort of understanding, empirical understanding of what's happening. So I think we still do need those experts to really to make sense of, what is actually currently sort of happening. And then, like I do this all the time. I'll go on, some local, news channel to give folks a better understanding of like, where are we at during the flu season, or where are we at with, the increasing number of cases of COVID-19, or even common cold, and how people can protect themselves. Right. So that's just, and there's nothing inherently divisive about that. That's just
Mhm.
like, that's somebody who got trained in it's just like if I were a firefighter, right? If I were a leader in sort of the fire service, and I'm telling people how to protect their homes, and I'm saying that this is particularly, I live in California, right? Like this is, there are inclement weather patterns where people should be implementing additional precautions, et cetera, to ensure that their homes are protected.
Mhm.
That's a thing, right? I don't think there's a lot of like, there's
Yeah.
not a sort of divisiveness about that. Why? So using that, I often like to use that as a sort of a countermeasure to public health. It's like when it comes to the fire service and interpretations and predictions about risks of fire, we're not often sort of arguing about that. We do argue about the LA fire,
Yeah.
right? And that
Yeah.
was politics, right? Because, and I would, often sort of, because many of our operations are down in LA, I would, let's let the leaders respond to this first, and then we can criticize, what happened, but but that was a carve out. In general, people are not going to have strong divisive opinions about protections, for fire. So
Yeah.
again, this has a strong intersection with public health. Why we can't apply that perception to public health to me is not clear. And I think historically we sort of did. I think it was the increasingly it was more a bit with childhood immunizations, but it really scaled with the massive immunizations that we did with the COVID-19 pandemic. That a lot of folks I don't even think understood public health, right? And for the first time that I've ever seen, we've had all these armchair epidemiologists know, "Oh, well, I think the positive predictive value of this is like," you know,
Yeah.
so and I appreciate people doing their reading and trying to sort of, trying to come up to speed in terms of like what's actually happening. But you still need the weatherman sometimes or weather human sometimes. You still firefighters, you need the experts to make sense out of what's actually happening, things that you cannot see.
Yeah. And one of my early memories in COVID times, you talk about how things were moving so fast. There was a point, it was late April 2020. My wife and I were moving from Orlando to Los Angeles. We literally drove 2,500 miles during peak pandemic. People were just starting to wear masks. Quite often, the cloth variety word was getting out about that. And I'll never forget driving across the border from Louisiana into Texas. Texas was still taking the pandemic seriously. Like we had to pull off the freeway, there were health checks. The state police were wearing masks and it was all being, taken very seriously. And we got out to California and it was being taken very seriously. And we saw a family in Texas and, we would come back during pandemic times and by July, not even just the state, but certain counties and even a city within the county had basically decided, no, the pandemic's over.
Yeah.
And it's almost like the disease and the pandemic was spreading faster than I'm going to point to politicians who then figured out I can gain votes saying certain things, whether I think they're right or whether it'll get me votes.
Mhm.
Like that seemed to move slower and then it caught up. And then we get this polarization. Sorry.
And that's dangerous because I mean, these politicians were basically spreading disinformation or let's really, call it what it is, which were lies, right? And that it's again kind of using that analogy for fire. If you are telling other people it's safe to go outside, but the reality or whatever, safe to go inside, whatever the right sort of, fire correlation is, and you're actually putting people at risk of being exposed to that fire, then that lie could lead to fatalities. And, the problem is, with infectious diseases, because it's this invisible, not invisible, but, microbial, microscopic sort of, correlation, which leads and there's this sort of delay in terms of, infection and sort of, symptoms. It's harder to sort of draw a linear sort of connection from X to Y, right? And so, and then of course people were disputing the fact that it was even real. So again, it really takes, it's not, the politicians are not gonna be able to fix this. It's really gonna be us. It's really gonna be the public health leaders across the country, and we should all be, whether we're in Florida, whether we're in Tennessee, whether we're in Oregon or California, we should all be adhering to the same principles. And I know that we do. I mean, I know a lot across the country, and so if we really can stick together, if we really stick together and really ensure that we are not having our own echo chamber, that we're actually connected to the communities because this was missing during the pandemic, right?
Yeah.
We started even in places like California, we just started doing stuff and telling other people, you got to do this. And sometimes it didn't make sense, right? It actually didn't, and I won't make any comments, but there were certain things that did not make sense, even as somebody who is, pretty, very sort of forward thinking, and we didn't explain it right to him. So that was an issue. Now, sometimes during emergency response, you don't have that much time, but that's why we need to have those conversations ahead of time so that, when an emergency takes place, we can tee up those partners and be like, all right, guys, let's put together a town hall. This is what's happening. Please tell your community this way. And ultimately they'll listen to what we're saying because we've established that trust ahead of time.
Yeah. So maybe the final thing to dig into is, this idea of quote unquote being wrong versus not understanding yet. Making mistakes versus scientific knowledge evolving and changing. So one of my other vivid memories, and this would probably still be the case today, is talking to somebody who I think was making we might call a knowledge mistake and being so convinced of saying, well, masks are useless because look, the virus is smaller than the gaps in the mask. I mean, like, well, but the virus is on water droplets and the droplet is big enough to get caught. And this person is it was so convinced they're never going to be convinced of the effectiveness of a mask, even trying to point to basic physics. Well, before I go to the other point or example, I mean, what hope do we have? It's so when someone's this is a human frailty on our parts or a cognitive bias. Like when we're convinced something is right, it's really hard to convince us to change our minds. What can we do?
I mean, I in those situations, I think you really need to those are case by cases, right? Like we need to just it's in my life, we have, time and materials, right? And in my own personal life, time is my most important sort of,
Yeah.
commodity. And so I'm going to spend my time based upon encounters that I think that there's, an effect that I can sort of, have on that individual or that community or that, population's level. If I feel like if I get into a certain situation and I'm convinced that this person is so far it's so far beyond sort of reaching or changing, then I just need to acknowledge that, right? And I just say,
Pick
"Okay,
your battles.
exactly. I respect your opinion. You have obviously thought a lot about that. If you want to have, another conversation where we can talk a little bit more about the evidence, I'm happy to have her. But sometimes if people are just so far convinced and they're just reading from a completely different encyclopedia batch, it doesn't match. It's a different language, right? It just doesn't, and it's not gonna move the needle. So yeah, pick your
I mean,
battles.
but that's the difference between opinions and facts. I mean, I would have trouble. Maybe I'm not as able to be the bigger man here of saying, well, I don't respect your opinion because that opinion has an impact. I'm concerned about you, and I'm concerned about other. I mean,
Well, and our
what
That's the problem with public health, right? It's not when we talk about public health, it's not about you absolutely in the United States, if somebody wants to make an individual decision about their own healthcare, right? That does not impact other people, that is
Mhm.
absolutely your decision, right? That is so important. That's ingrained into us in our medical training, that
Yeah,
autonomy versus sort of paternalism, which is a model that sort of, changed over the course of decades. So absolutely respect that. But if people are making decisions that are going to hurt their communities and the public at large, then that's where we need to intervene. And so concrete examples of that, or we just covered was tobacco, right? Cigarette smoking, seatbelts, drinking and driving, and vaccinations and masks. These are things that are real safeguards that exist, and they are there to not necessarily to protect you, but they're there to protect your communities. And I'll make one important sort of reference point to other cultures where I see a radical difference are in East Asian societies. So
mhm,
I spent many years living in places like Japan, Korea, Thailand, and face masks existed there way before we were really using them at scale,
yeah,
right? Particularly like the SARS epidemic wasn't quite a pandemic, that existed in 2003, 2004, as well as, they had MERS, Middle Eastern Respiratory Syncytial Virus. By the way, these are all coronaviruses.
mhm,
And then way beyond that, I mean, TB, et cetera, et cetera. We know that most of tuberculosis comes from East Asia, et cetera. So face masks existed, but here's the rub. It didn't exist necessarily to sort of protect the individual. It existed in order to protect the communities because
right.
East Asian cultures subscribe to this Confucian culture where it's not an individualistic society. It's a community based society where the community or the group matters more than the individual. And I love our
Yeah,
individualism. I'm a very creative person, but I wish we had some balance and we cared more about, more of a selfless society where it's not
yeah,
just about you, it's about your community,
yeah.
guys.
Because yeah, I mean, today in 2026, if I see somebody at the grocery store wearing a mask, I think, well, they are choosing to protect themselves. They might be immunocompromised, what have you, or worried about getting sick. I've spent a lot of time in Japan, and prior to 2020, it was explained to me, like you said, that if I've got the sniffles, I'm going to put on a mask because I don't want to get someone else sick. That's a beautiful mindset.
Yeah. Yeah.
But let's talk one other thing. When it comes to learning new things and evolving. So when I went to LA, the only thing that, and this is hindsight thinking, and I think I'm enough of a scientist to try to look at this properly. But when we moved out there, there were of course a lot of restrictions on doing things indoors, places were shut down. The thing that seemed goofy, the only thing I really poked at even at the time was that the beaches were closed and even the walking and bike paths along the beach were closed. Now, like I could go walking recreationally down a street, which really didn't have any more of a density of people than the beach path might have. And like, oh, well, but that was a state mandate, and I think to Governor Newsom's credit, he did things wrong, but in some other instances, but they finally realized, okay, well, no big. I'd say, well, okay, that's an evolving understanding. Like, okay, the pendulum probably swung too far, but it was well intended, and now they've opened up the beach paths, and we can go walk and bike, and then there was further understanding of like, well, if you're going to gather with people doing it outside on the beach around a fire pit, it's about as safe as any you could be. If it's okay to be in your backyard, why not? So things evolved, and I didn't really begrudge that, but then I think when the other thing that came to mind, and I'll shut up and listen to your thoughts, was around vaccines. That early on, and I was eager to get vaccinated, and I was happy that I could. Part of that was the idea at the time that the vaccines were said to not only protect you, but to stop or slow the spread. And then, if I'm remembering this right, Omicron came. And that's where, like, oh, okay, with this new variant, the vaccine doesn't have that same protection against spread. And people jumped all over that politically. Like, well, science people, medicine people, you were wrong. I'm like, well, no, that seems that's unfair. Things changed.
Okay, I will try to organize my
Well,
thought.
I didn't frame that as a question. I apologize. But what are your thoughts? I'll let you think about that for a second.
So I'm hearing t 2 questions, comments, and I'll make more questions. One is, okay, so when in California or other states, when we, started creating a lot of these, public health officer orders, a lot of folks had never even heard of a health officer before, right? Or commissioner. And so for the first time now, these doctors who they never heard of are now kind of putting out these executive orders
Yeah.
that told them to not do X or Y, and particularly in places in like New York, where I was chief medical officer, New Yorkers being told what to do. So yes, I agree that there was one of the challenges, and I'm saying this very carefully. One of the challenges, even in public health, is that sometimes when we are responding to things very quickly, we don't really have we should there's something called public health emergency preparedness. So we should have our plans in place so that we're doing all these exercises and drills so that when the actual real event does take place, we're ready to go. I don't think that public health emergency preparedness was taken as seriously as it should have been across the
Mhm.
I think we are much more prepared now, but we hadn't had a COVID-19 pandemic. We had, an H1N1. We had, of course, SARS and Ebola had sort of, were looming in the backgrounds or whatnot, but we weren't quite ready. And so I think that a lot of health officers, I think the pendulum did swing, and a lot of health officers were making decisions that they were using the best intentions, trying to create as many protections as possible because they didn't understand this emerging communicable disease. A lot of folks didn't. The problem is a lot of public health officers are not infectious disease doctors, right? Because again, public health is way bigger than just diseases. Okay. I know public health officers that are OBGYNs or internists or family medicine docs, et cetera, because again, it connects to a lot of, so there's no right specialty to be a leader in public health. But understanding when you're dealing with an infectious disease outbreak, you should probably have the infectious disease specialist, particularly that understand this, on speed dial. And that was kind of lacking. And even in a place like California, which is so abundant, like, training resource was lacking. And I live in Santa Cruz County. So the beaches, like that is literally the best place that you want to go, right? Because it's the lowest population density. It's, free air, it's ocean. Like, go let people surf. They ain't getting pandemic, out. They're not getting infected out there.
Right.
Think like skiing, like oh, yeah, chairlifts, maybe there was some, some
Yeah.
population there, but you literally have your face mask
Right.
on. So the next time we're out, I think we'll be more prepared. But again,
Draw.
this is why public health professionals really need a synchronized way to connect. And in my book, I talk about, I really, in more responsible governance, I would say that would come from the Surgeon General, and he or she, they have a public health, the U.S. uniform public health professionals across the country that could ultimately be the foot soldiers to help to sort of, distribute that sort of those guidelines, reconnecting the communities, connecting the states, the cities and counties. That connection doesn't exist, and we're far off from that. But that would be the best way that we can do that. And then, and the final piece was for the folks that are still in 2026 wearing their face masks sometimes in the grocery store where there's low population density. If they're using it because they're sick, 100%. That is great. They're saying, I care about my community. I don't want to get people sick. However, we take education too, because a lot of those folks are still in their minds, they're still scared about, about sort of risk factors beyond they like say they're not sick. So I think we need to move that pendulum back and really provide, it's like, you know, I'm infectious disease doc. HIV has been, my number one sort of focus. Wearing two condoms, not a good
No.
idea. It
Right.
actually it actually reduces the sort of protections, that exist because it creates more friction than necessary. So sometimes, less is more, and so we more more education on that.
I mean, the thing about somebody choosing to wear a mask even today, even if they are overestimating the risk, I mean, fair to say that's not hurting anybody.
No, it's not hurting. No, it's not hurting. It's just, it, it sometimes it undermines the sort of it undermines the real effect of the face mask. Like, face masks should be used during certain times. If you are sick or if there is an increased risk of X taking place, right? Like that is now people may always take something a little bit to it's like with this seatbelt, right? Like, you might I haven't heard of two seatbelts, but like, you could folks wearing their backseat, and sometimes you can take things a little bit too far and be a little bit too precautious. But, does that hurt anybody if you are too precautious? Probably not.
And a fair point about double condoms, not something I'd ever thought about. And we're going to leave that to the listener as we wrap up the episode.
It was the same thing actually with double gloves, right?
Yeah.
When I was the chief medical officer in New York City, we were trying to recommend people to be using one pair of gloves, use them correctly, and we would often see people with the two or three gloves, two or three masks, and it was just a bit too much. So
Yeah.
I like condom because it gets people like you chuckling, and it's true.
Yeah. Very good. Expertise coming at us here. So, Dr. Tyler Evans, the book is Pandemics, Poverty, and Politics Decoding the Social and Political Drivers of Pandemics from Plague to COVID-19. As you touch on in the book, hopefully, we are better prepared for when this is bound to happen again someday. I don't know if there's a quick answer to this question. Is it going to be another 100 years?
No,
That's just random.
no, it'll be before, but hopefully we'll be prepared.
I hope so. So, from what I've read in the book, it looks like there's a lot of great recommendations there, and congratulations on the book. I hope people who are in a place to put some actions into place read it, take it to heart, and learn from an expert. So, Dr. Evans, thanks so much for sharing your story and your reflections and your thoughts and expertise. I appreciate it.
Thanks, Mark. Appreciate it.